Watchdog here. I collaborate with the Citizens Commission on Human Rights in investigating, documenting, and exposing human rights violations in the mental health field. And there are many. CCHR is a nonprofit, non-political, and non-religious mental health watchdog organization which has been around since 1969. CCHR fights to restore basic inalienable human rights to the field of mental health, such as fully informed consent regarding the medical legitimacy of psychiatric diagnoses, the risks of psychiatric treatments, the right to all available medical alternatives, and the right to refuse any treatment considered harmful. Now, why would the mental health system need a watchdog? Well, the reasons are many. Countless stories of patients' rights violated, mislabeling, overdrugging resulting in homicides, suicides, or simply a worsening of the patient's condition, fraudulent activity, ECT, or electroconvulsive therapy, and yes, this barbaric form of treatment is still being used today. All this in the guise of mental health. Now let's just take one of those topics. Today I'll be discussing the drugs which are prescribed as a solution to mental problems. Specifically, the side effects of the 5 most prescribed psychotropic drugs in the USA. Psychiatry has been the go-to system for mental health for many years. And when someone with valid mental problems, which are personally troubling and very real to them, comes to a psychiatrist for answers and help, well, they expect to be helped, especially for the amount of money they're being charged. Well, the mental health system is infamous for prescribing antidepressants and antipsychotics as a form of treatment, when actually these drugs have, each one of them, a long list of side effects that are usually worse than the symptoms the person originally came in to fix. And this is the usual avenue taken by most psychiatrists. This is what is offered as a solution. But are these drugs safe, even if a licensed and learned psychiatrist says they are? Well, it doesn't take a rocket scientist to just Google up the drug name plus side effects to discover how safe they are. And this is exactly what I did. Thank you, drugs.com. And let's just dispel this point right at the start. Side effects is a misnomer. They're simply effects. There's nothing side about it. If you slam a mallet on your foot, is the excruciating pain a side effect? No, it's an effect. The term side effect is a fancy way to dance around the undisclosed truth that these effects are more adverse than beneficial. Anyway, here are the top 5 psychotropic drugs and the reported side effects. Common side effects of Xanax include cognitive dysfunction, constipation, fatigue, memory impairment, skin rash, weight gain, weight loss, anxiety, blurred vision, diarrhea, insomnia, decreased libido, increased or decreased appetite, hypotension, sexual disorder, muscle twitching, increased libido, feeling sad or empty, loss of interest or pleasure, shakiness and unsteady walk, slurred speech, trouble speaking, unsteadiness, trembling, or other problems with muscle control or coordination, unusual tiredness or weakness. Less common side effects are uncontrolled physical actions, attack, assault, or force, chest pain, continual ringing or buzzing in the ears, decreased awareness or responsiveness, deep or fast breathing with dizziness, ear pain, hoarseness, loss of control of the legs, nightmares, numbness of the feet, hands, and around mouth, shakiness in the legs, arms, hands, or feet, sleep talking, thoughts of killing oneself, uncaring, voice changes. And yes, you heard me correctly. I actually said thoughts of killing oneself. Just one in a sea of effects that aren't very therapeutic at all. It's like, here's your treatment. Oh, by the way, you'll probably feel worse and you just may want to end your life. Other than that, everything will be good. Common side effects of Zoloft include diarrhea, dizziness, drowsiness, dyspepsia, fatigue, insomnia, loose stools, nausea, tremors, headaches, anorexia, decreased libido, delayed ejaculation, ejaculation failure, abdominal pain, agitation, vomiting, anxiety. Less common effects are aggressive reaction, confusion, convulsions, dryness of the mouth, fever, inability to sit still, increase in body movements, increased sweating, increased thirst, loss of bladder control, mood or behavior changes, muscle spasms or jerking of all extremities, nosebleeds, overactive reflexes, racing heartbeat, red or purple spots on the skin, restlessness, shivering, skin rash, hives or itching, sudden loss of consciousness, unusual or sudden body or facial movements or postures, unusual secretion of milk in females. So have you ever heard of tardive dyskinesia? This condition is a side effect of antipsychotic medications like Zoloft. TD causes stiff, jerky movements of your face and body that you can't control. You might blink your eyes, stick out your tongue, wave your arms around without meaning to do so. It's like having body Tourette syndrome. And it's an irreversible condition in most cases. So, here's your Zoloft for your depression, and you might develop permanent uncontrollable facial and body movements and a whole list of other negative effects. But other than that, you'll be good. Common side effects of Celexa include drowsiness, ejaculatory disorder, nausea, insomnia, suicidal tendencies, agitation, diarrhea, impotence, sinusitis, anxiety, confusion, exacerbation of depression, lack of concentration, tremor, vomiting, and anorexia. Now, there are many more side effects and less common ones as well. But I like to draw the line at suicidal thoughts. When you've put your trust into someone to help you with mental problems that are very real to you, and you're prescribed a drug that could put you in a mood in which you might take your own life, we're talking a major betrayal of help here. And people are getting paid for this. Corporations are making serious bank from this. Common side effects of Prozac include hives, itching or skin rash, inability to sit down, restlessness. Less common effects include chills or fever, joint or muscle pain, anxiety, cold sweats, confusion, convulsions or seizures, diarrhea, difficulty with concentration, drowsiness, dryness of the mouth, excessive hunger, fast or irregular heartbeat, headache, increased sweating, increased thirst, lack of energy, mood or behavior changes, overactive reflexes, purple or red spots on the skin, racing heartbeat, shakiness or unsteady walk, shivering or shaking, trouble with breathing, unusual or incomplete body or facial movements, unusual tiredness or weakness. Prozac is an antidepressant which is prescribed to treat major depression, obsessive compulsive disorder, and panic disorder. So people complaining of these problems will most likely have to exchange one or more of them for one or more of these effects. It's a gamble. Who knows what you'll end up with? I'd take depression over convulsions, diarrhea, a racing heartbeat, anxiety. Wait, anxiety? I thought I'd be getting rid of anxiety. So I could trade anxiety for anxiety, and I have to pay someone for this? Common side effects of Ativan are changes in patterns and rhythms of speech, increased sweating, loss of strength or energy, nightmares, shakiness and unsteady walk, slurred speech, trouble speaking, unsteadiness, trembling or other problems with muscle control or coordination, unusual drowsiness, dullness or feeling of sluggishness, unusual excitement, nervousness, restlessness or irritability, unusual paleness, unusual weak feeling, fatigue, drowsiness, amnesia, memory impairment, confusion, disorientation, depression, euphoria, suicidal attempt, convulsions or seizures, tremor, vertigo, headache, coma, respiratory depression, apnea, jaundice, allergic skin reactions, anxiety, agitation, hostility, aggression, and rage. Now, that is a long list of common side effects. Ativan is usually prescribed to treat anxiety and stress disorder. This is the drug many celebrities who took their own lives were on, including Heath Ledger and Michael Jackson. It's also the drug that singer Chris Cornell had in his system when he hanged himself to death. Shortly before he committed suicide, he called his wife and told her he took a double dose and wasn't feeling himself. He was basically telling her he had some of these symptoms. He didn't tell her, however, that he was planning to end his own life. And now, we don't have Chris Cornell anymore. The bottom line here is that these drugs are being prescribed in the name of help, but they are doing the opposite. And you would think that after some time, psychiatrists who prescribe these drugs would see that they just aren't helping. So then an appropriate question to ask at this point would be, why do these prescriptions continue to the tune of billions of dollars annually? We have to be on the ball about these drugs and watch what we put into our own bodies. It's our responsibility to do so. We need to be smart and research them and get second and third opinions before taking them. Don't just blindly trust a psychiatrist. And drugs are never good for the body. Generally speaking, they create a weakened immune system, which increases the risk of illness and infection. And they cause heart conditions ranging from abnormal heart rate to heart attacks. So no matter how you slice it, drug therapy becomes basically an oxymoron. And it's one of the most lucrative oxymorons in existence. So if you're prescribed psychotropic drugs to treat your mental problems or insomnia or any of that, be sure to research these drugs and get all the information, or else someone will get richer off you getting worse. That just doesn't make sense now, does it? And you too could be a mental health watchdog. In fact, I want you to be. You don't need to have a college degree or a diploma to be able to spot inhumane activity. You were born with the ability to tell right from wrong and spot things that just ain't right. So use that ability and report any abuses or strange occurrences you find in the mental health field. And if you or anyone you know has been abused by a psychiatrist or psychologist in any way, physically, mentally, emotionally, sexually, financially, report it to CCHR. If you've witnessed human rights violations in a mental health facility or by psychiatrists or psychologists and wish to blow the whistle, contact CCHR. Here's the email address: abuse@cchrSiliconValley.org. I'm the Mental Health Watchdog. Stay alive and healthy, and catch you later.